at hiding their behaviors. The cycle can go on for years without anyone knowing. The person feels trapped, consumed by thoughts of food, weight, body shape. Treatment focuses on breaking this harmful cycle. Therapy is a very important part of treatment. Cognitive behavioral therapy, CBT, is highly effective. CBT helps identify triggers for binges. It also teaches healthier coping with difficult emotions. Nutritional counseling with a dietitian helps develop a regular, healthy eating pattern. Sometimes medication, like certain antidepressants, can reduce the urge to binge and purge. The signs of bulimia can be more subtle than the signs of anorexia, but they are just as serious. You might notice evidence of binge eating, large amounts of food disappearing from the kitchen, finding hidden food wrappers. A key sign is a person frequently going to the bathroom right after meals. They might run the water to hide the sound of vomiting. Physically, you might see swelling in their cheeks, swelling in their jaw area, which is caused by swollen salivary glands. Their knuckles might have calluses or scars, known as Russell's sign, from inducing vomiting. Other physical signs are related to the damage caused by purging. Frequent vomiting can erode tooth enamel, leading to cavities and tooth sensitivity. A dentist is often the first healthcare professional to notice these signs. The person might complain of a chronic sore throat or indigestion. The misuse of laxatives can lead to long-term bowel problems and dependence on laxatives. The cycle of binging and purging can also disrupt the body's electrolyte balance. This is very dangerous and can lead to irregular heartbeats and, in severe cases, heart failure. Let's think about a patient named Mark. Mark is a 22-year-old college student. He feels a lot of pressure to succeed in his classes and on his university's wrestling team. To make his weight class, he started to restrict his eating. But this restriction led to intense cravings. He began to have episodes where he would secretly eat huge amounts of food from the cafeteria. Afterward, he would feel terrible guilt and panic about gaining weight. He would force himself to vomit to get rid of the food. He felt trapped and ashamed. Named Mark. Mark is a 22-year-old college student. He feels a lot of pressure to succeed in his classes and on his university's wrestling team. To make his weight class, he started to restrict his eating. But this restriction led to intense cravings. He began to have episodes where he would secretly eat huge amounts of food from the cafeteria. Afterward, he would feel terrible guilt and panic about gaining weight. He would force himself to vomit to get rid of the food. He felt trapped and ashamed, and he told no one about his struggle. Mark's story shows how bulimia can be a hidden illness driven by pressure and stress. His teammates and coaches just saw him as disciplined for making weight. They did not see the chaotic and painful cycle he was trapped in. He felt isolated and believed he was the only one with this problem. One day he felt a sharp pain in his chest and his heart was racing. He was scared and finally told his coach. The coach helped him get an appointment at the Student Health Center. This was Mark's first brave step toward confronting the illness and learning a new way to live. Morbid obesity is a serious medical condition. It means a person has a very high amount of body fat. This is different from just being overweight. It is a level of obesity that significantly increases the risk for many other health problems. These problems can include type 2 diabetes, heart disease, high blood pressure, and certain types of cancer. It can also cause problems with joints like the knees and hips because of the extra strain on them. Morbid obesity affects a person's quality of life and can shorten their life expectancy if it is not treated. To understand morbid obesity, we use a tool called the Body Mass Index, or BMI. BMI is a simple calculation. It uses a person's height and weight to estimate their body fat. The formula gives you a number. This number helps doctors classify a person's weight status. For adults, a BMI between 18.5 and 24.9 is considered a healthy weight. A BMI of 25 to 29.9 is considered overweight. A BMI of 30 or higher is classified as obesity. This tool is a starting point for doctors to assess health risks. Morbid obesity, which is also called severe or class 3 obesity, is defined by a very high BMI. A person is considered to have morbid obesity if their BMI is 40 or higher. A person can also be diagnosed with morbid obesity if their BMI is 35 or higher and they have a serious health problem related to their weight. For example, someone with a BMI of 36 who also has type 2 diabetes would be considered to have morbid obesity. This diagnosis is a signal that the person's health is at significant risk and that medical intervention. Let's look at an example. David is 45 years old. He is 5 feet 10 inches tall and weighs 310 pounds. When his doctor calculates his BMI, the number is 44.5. This number is in the morbid obesity range. David also has high blood pressure and sleep apnea, which is when you stop breathing for short periods while you sleep. His doctor explains that his weight is a major factor in these health problems. David finds it hard to walk long distances and play with his children. His BMI calculation helps him and his doctor understand the seriousness of his condition and start a conversation about treatment options. For some people with morbid obesity, diet and exercise alone are not enough to achieve significant and lasting weight loss. In these cases, doctors might recommend bariatric surgery. Bariatric surgery is a type of surgery that helps people lose weight by making changes to their digestive system. It is not a cosmetic procedure to remove fat. Instead, it is a medical tool to help treat a serious disease. There are different types of bariatric surgery. Some work by making the stomach smaller, so the person feels full after eating less food. Others work by changing the path food takes through the intestines. They also meet with psychologists and therapists. This is important to make sure they are mentally prepared for the changes ahead. The surgery changes how they eat, but therapy helps them change their relationship with food and address any underlying emotional eating patterns. Let's return to our example, David. After talking with his doctor, David decides to explore bariatric surgery. He attends an informational seminar at the hospital. He then begins the required evaluation process. He meets with a surgeon, a dietitian, and a psychologist over several months. He learns about the risks and benefits. He starts practicing the new eating habits he will need after surgery. The counseling helps him understand that the surgery is a tool, but he will need to commit to lifelong changes in his diet and lifestyle to be successful. Eating disorders are complex illnesses with no single cause. Instead, they develop from a mix of different factors. Psychological factors play a big role. Many people with eating disorders also struggle with other issues like anxiety, depression, or obsessive compulsive disorder, OCD, low self-esteem, and feelings of not being good enough are very common. Perfectionism is also a strong risk factor. A person who feels they must be perfect in every way may turn to controlling their weight and food as one area where they can achieve that feeling of perfection. There is also strong evidence for genetic and biological causes. Research shows that eating disorders often run in families. This suggests that some people may inherit genes that make them more vulnerable. If you have a close relative, like a mother or sister with an eating disorder, your own risk is higher. Scientists are also studying the brain. They have found differences in brain structure and function in people with eating disorders. brain with arrows labeled appetite, anxiety, and body image. These differences might affect appetite, anxiety, and body image, making it harder for some people to have a healthy relationship with food. Cultural and social pressures also contribute to the risk. In many Western cultures, there's a strong and constant message that being thin is a sign of success, beauty, and happiness. And this message is everywhere. In movies, on television, and on social media, this can create intense pressure, especially for young people to have a certain body type. For some, the desire to fit this cultural ideal can trigger unhealthy dieting behaviors. These behaviors can then spiral into a full-blown eating disorder, especially in someone who is already vulnerable due to psychological or genetic factors. In summary, we can think of it like this: genetics may load the gun, but environment and personality pull the trigger. A person might be born with a biological predisposition that makes them more susceptible. Then they might experience psychological distress like anxiety or trauma. Finally, they live in a culture that praises thinness. The combination of these factors, psychological, genetic, and cultural, creates the perfect storm for an eating disorder to develop. This is why treatment must address all of these different areas to be effective. It is not just about food, it is about the whole person. Nurses play a very important role in caring for patients with eating disorders. A key part of this role is to build a trusting relationship with the patient. It is essential for the nurse to be compassionate. It is essential for the nurse to be patient. It is essential for the nurse to be non-judgmental. Patients often feel deep shame and fear. Creating a safe space for them to talk is the first step. The nurse should listen to the patient's feelings without criticism. Simple supportive statements can make a big difference.